The Middle East Respiratory Syndrome, or MERS outbreak, isn't showing signs of slowing down here in Korea. 23 more cases have been confirmed overnight, bringing the total to 87. The death tally rose to 6. For more, we connect to Connie Kim at the news center. Connie, give us some details about the numbers and more.
Well, Daniel, the male patient in his 80s who died this morning was originally hospitalized for showing symptoms of pneumonia. He started receiving treatment in an isolation ward in Daejeon when he tested MERS positive 2 days ago. With his symptoms deteriorating, he was set to be transported to a government-designated hospital this morning, but unfortunately died. Korea's health ministry said 17 of the newly confirmed MERS cases came from one well-known hospital in southern Seoul. The 6 other MERS patients were exposed to the disease at 2 different medical facilities. And 10 patients out of the 87 confirmed cases are reported to be in critical condition. Up until now, the virus has affected older people, but the latest update shows we have the first teen MERS patient. The high school student was already at the Samsung Medical Center after having brain surgery, so health officials decided not to move him to a separate quarantine facility. Authorities say, however, there is no possibility of the virus spreading outside the hospital as he had no outside contact. They add there hasn't been a case where a person with a strong immune system contracted the disease. The second MERS patient released from hospital says his symptoms were not any more serious than flu symptoms. Authorities are also encouraged by 0 additional infections at the Pyeongtaek Hospital, with the highest number of confirmed cases, suggesting they may have successfully contained the virus. And in a press briefing this morning, a health official from MERS Central Response Headquarters said the virus spread will reach its peak this week and decline afterwards.
We're seeing some glimmers of hope there, Connie. And I also heard the World Health Organization officials are here in Korea. What will they be doing during their trip here?
Well, Daniel, a joint South Korea WHO response team will assess the current MERS situation and come up with additional measures to contain the virus. Now, during their 4-day investigation, the team will be checking out quarantine facilities and tracking down the virus infection route by visiting hospitals that are treating MERS patients. Korea now has the second highest number of reported MERS cases after Saudi Arabia, which has 1,019 MERS patients. WHO Director General Dr. Margaret Chan said it's critical to reduce the number of hospitals treating patients in order to decrease exposure to the virus. The organization is not directly involved in developing vaccines for the virus, but is initiating talks with research groups that are working to find a cure for the disease.
And we can find solace in the fact that no MERS infections have been detected outside hospital wards, but the government is taking extra cautionary measures, we believe. Connie, I heard hundreds more schools were closed down today.
Daniel, the Education Ministry has closed more than 1,800 elementary and preschools today. Now, of those, more than 1,000 are in Gyeonggi-do province, where the first MERS patient was confirmed. Now, the government is also updating the list of hospitals affected by MERS. Now, if you take a look at the map right here, 6 of the hospitals where patients have been diagnosed are spread out across the nation, and there are 23 more hospitals where patients with the disease have passed through, meaning these could be possible new sites of infection. And there are more than 2,500 people in quarantine, but more than 500 people are no longer in quarantine and deemed healthy. Back to you.